for you parents this morning. I want to be joined now live with Dr. Erez Dayan to talk about, Doctor, I'm in a number of groups for parents. I'm a new mom actually myself here in the Las Vegas Valley, and I've seen a lot of conversations. I've learned a lot about the changes that can happen to your body after having a baby with those muscles in your abdomen. So let's talk a little bit more about what that means and what can be done as an option.
Yes, well, thank you for having me and congratulations.
Thank you.
In plastic surgery, I always tell patients the things that keep us going are babies and gravity. And with all the wonderful components of pregnancy and having a baby, there are significant changes that happen to your body in terms of stretch of the soft tissue, of the muscle envelope. And many times, female bodies just have a hard time recovering from that and have lingering effects such as muscle separation, known as diastasis recti, or soft tissue laxity.
If there is someone watching and they're thinking, okay, diastasis recti, this is something that I've heard, I've been looking into, and they want to learn more from you about what can be done, what can they do, what would be an option for them?
Well, essentially, diastasis recti is when your six-pack muscles separate and it causes bloating. Oftentimes, even women who are very thin can notice this bloating. And there are basically, classically, there's only been one solution, which is a surgical solution called an abdominoplasty or a tummy tuck. But now with newer technology, we are using muscle stimulation devices, radiofrequency skin tightening to improve those areas. So the device we like to use in my practice is one of the latest devices for this called Evolve by a company called InMode, which is one of the leading non-invasive body contouring devices. And there have been studies done in South America and other parts of the world to show that you can improve the diastasis recti and contract soft tissue without any surgery.
So as you're pointing out, non-surgical, how exactly is the treatment done then?
Well, it's actually a very comfortable treatment. We performed the trials of it about over a year ago. And what we learned is that there's a technology called EMS, electrical muscle stimulation. And they're basically these pads that you're able to put over your muscles, and they produce a supraphysiologic contraction. So a contraction that you couldn't possibly produce in the gym. And that strengthens your core muscles and will, because of the strengthening of the core muscles, will improve the core strength and narrow the diastasis. And there's another component to the device that tightens the skin using radiofrequency heat, which produces more collagen and gives you some soft tissue contraction. So this really benefits women in their 30s, 40s, 50s who really don't want to go through a surgical solution or are not, quote unquote, severe enough for a surgical solution, but do want to improve their core strength and soft tissue contraction after pregnancy.
Well, Dr. Dayan, thank you so much for joining us this morning. We'll get everybody connected with you if they're interested on our website. That is news3lv.com. Have a great
Thank you so much. Have a great morning.
Of course. Thank you, you too. At